Hi, my name is Dr. Jim Carlson, and we're talking about case number 01703, 4-year-old golden retriever with a history of allergies, and the current symptoms are lesions on the underside of the trunk or the abdomen, and anxious behavior. And as we see, as we step out from where these symptoms come from, the pattern is a heat-deficient pattern for lesions or skin infection, which on the IHT, the balance sheet, we see weak kidney, stressed liver, weak gallbladder, and stressed bladder as being the root causes for this heat deficiency and then the skin infection. And we also have anxious behavior. So where did that come from? Well, it's an outward excess, which means too much outward activity, too much anxiousness, which, if we come over to the balance sheet, we find that we have a weak pituitary and pineal gland, or sensory function, and poor filtration, and so that can make the central nervous system very, very anxious. And so when we look at allergies, often dogs that have skin infections, we think about allergies as being the root cause, when in fact, this 4-year-old golden just has quite a few sensitivities. And those sensitivities are going to be tipping points for inflammation, but allergy and sensitivity are much different. Allergy is when the body pulls it in and continues to react to it, where sensitivities, the body pulls it in, reacts to it once, and as long as we're not being exposed to it, then we would stop reacting to it. But in the environment here, we have a number of things. Certainly, I'll go over this and have the owner review this because there would be a number of things here based on the time that we have to go over it. There'd be a lot of things to cover. You notice, for example, here in the group we see environmentals, we see epidermals, and then animals, and then specifically spiders. So this particular dog has wolf spider sensitivity and the red back spider. Both of these are indigenous to Illinois, so it's quite possible that an accidental exposure could create inflammation. Also, fossil fuels. Surprisingly, dogs and cats can be very, very susceptible to fossil fuels, especially natural gas. But in this case, our little friend was, and I'll go back to the last page here, is we're going to see that we were allergic to diesel, or sensitive to diesel fuel exhaust fumes. So traveling in the car, especially a camper, for using diesel fuel or tractors or things like that, for example, could certainly contribute to skin inflammation. So a treatment planning is going to be, we want to control the symptoms. So cephalexin is an antibiotic that would be good for the lesions, and also using damp heat skin for the pattern of heat deficiency for 3 weeks. And then as far as balancing, we would want to use Drain Par as a formula in which we would use to rebalance these weakness and stress points. For 3 months, retest, and then determine our progress and how good our patient is doing at that time.